Welcome to Autism Tips and Tools, where we highlight the best practical guidance from previous episodes of Autism Knows No Borders. Whether you're a self-advocate, a family member, or a service provider, there's something here for you. I'm Rachel Harmon, a professional in the field of autism services, outreach, and advocacy, and the following clip is from my conversation with Ryan Litchfield, an Autism and Disability Self-Advocate, job developer, and grant and administrator writer. Here's Ryan talking about the need for research on older adults with autism.
Understanding physical mental health in the context of older adults, it's essential to helping supporting their personal care needs. What I have found is that older adults with autism have associated health conditions like other older adults without autism. So that could be things such as osteoporosis, cognitive disabilities, heart disease, cancer, and osteoarthritis. Also, adults with autism also need to be monitored for seizure disorders. About a quarter of individuals with autism often have epilepsy. That's common, that's just in general. There's also hypertension and allergies as well. So because older adults have more needs because they have various healthcare needs and social needs, there's a possibility where I think that there could be a rapid increase in the aging effects, and there could be a quick, rapid decline in the effects of those aging, the physical, the biological, and the social effects. The other thing to also keep in mind is mental health. And I will say a lot of us, even myself, we have associated anxiety and depression. Anxiety and depression are very common in individuals with autism, not just for older adults, but for, children, adolescents, all these age groups. In older adulthood, there's also increased levels of depression and suicide, because as you get older, you lose people in your life, people pass on, people start to feel isolated. The services and the supports that you've had maybe when you were a child are starting to fade. So this is a legitimate concern, and especially the fact that there's not enough research about these specific things. And with people on the autism spectrum, because it is a developmental disorder, which involves, the behavior, the challenges with behavior, communication, social interaction, I mentioned how basically they may start demonstrating behaviors of aggression, property destruction, and even just some behaviors that are self-injurious. And those are some red flags that, it's good that we're seeing that, in the other age groups, but we still have to monitor those kinds of things in adulthood and older adulthood. And there's so many different things. And some of the issues that, again, we really have to start focusing on the nature and the degree of the healthcare needs, because the degree and nature of healthcare needs for one individual with autism might be different than another individual. Then you also have to consider the variations in the different communication abilities. Some might be able to verbalize like I'm able to, but some of them might not be able to, and they might use augmentative communication devices, or they might have to use alternate ways to communicate something. Then you have life transitions, which is what I kind of touched on with, the depression and the suicide piece, where, again, you have family members that are passing on, and then you have, and it's not like, an older adult is going to keep, there's some older adults that are working, but usually you're not working after that time. It's usually you're retired, and then it affects the flow of routine and stuff. And then it talk about, so clinical training. I was looking at a report. They talk about how among healthcare clinicians and stuff, the quality of care, especially for people with autism and, intellectual and developmental disabilities, they've done surveys and it's pretty much poor. I would say at most, the quality of care might be fair, but there's a good percent where it's saying that it's poor. And as I said, the next point I was saying, the lack of knowledge and skills to support older adults with autism, because there's not enough research.
Yeah.
That's why all these programs, talk about ABA, or you talk about, just autism in general, all these interventions and stuff, they were all focused on children and adolescents.
Yeah.
That's what it was on, long time ago. But all of a sudden, it's like, this is a new reality. It's like, hello, you got the statistics, you got the prevalence, the increased prevalence, and then you got all these things. And it's like, we got to start doing something about this, especially for me. It's a domino effect. And again, I talk about ineffective delivery of healthcare. I think we need to start really focusing on, how older adults with autism focus on, the differences in their environments and and how they respond to different things. In addition, improving research methods, I talk about effective communication, relationship building, and transparency among individuals, caregivers, and clinicians about the physical, mental health care needs of older adults with autism to providing quality health care. One other piece I will add is the social piece. Like, this is why I go back to talking about hobbies and interests and utilizing strengths and stuff. So I was doing case management and I was a peer specialist for a little while for an organization. And, it was a wonderful program to work with adults on the autism spectrum. And my philosophy was focusing on the individual and not just their autism. We have to look at their strengths. We have to look at the good in people, because sometimes the strengths and sometimes knowing, what they like to do can be all the difference in terms of, trying to improve their quality of life. And it has done wonders in that kind of an approach.
Thanks for tuning in to Autism Knows No Borders. Would you like to hear Ryan's experience receiving ABA therapy and how professionals can provide better support for their clients? Follow the link in the show notes for the full conversation, and be sure to subscribe to hear more from people connected to autism, inspiring change and building community. Let's work together to transform how the world relates to autism. Thanks for listening. Take care.